Happy Hump Day. I'm Dr. DeShawn Taylor coming to you from Phoenix, Arizona with my next installment of Well Woman Wednesdays. And today I want to talk to you about causes of bumps in the genital area. So my title today is that bump an STI? And I am going to be doing a second installment of this on my next session. So I am Dr. DeShawn Taylor. I am a board certified gynecology and family planning specialist and the founder and owner of Desert Star Family Planning, a clinic that provides abortion services, gender affirming care, and general well woman and gynecology care, STI testing and treatment. And I will be accepting new patients again starting the new year, 2022. And I just want to verify that we're live on all of our platforms. Excellent. And so let's jump on in here. And so if you have ever wondered if lumps, bumps, and the skin color of your vagina are normal, you're not alone. Vaginal bumps and lumps are common, especially during your childbearing years or as you age. When people refer to the vagina, they're often referring to both the internal organ, the vagina, and the external genitalia known as the vulva. The vagina is the muscular tube that leads to your cervix, which is the opening to the uterus. And the top layer of the tissue in your vagina is kind of similar to the tissue in your mouth or nose. It's called a mucous membrane. And so those are, they have some natural bumps and ridges on the surface, and that's called rugae. And so that's normal. So sometimes people kind of come to the clinic and they're like, there's something in the vagina, and I'll examine and I go, well, that's normal. And so this is probably people just learning, just now becoming sexually active, exploring and learning the difference in their bodies. But these rugae are very important because during sex or childbirth, this is what enables your vagina to expand. The vulva includes several organs. The labia majora, which are the outer lips of the vulva. The outer side of the labia majora is where the pubic hair is found. The hairless skin on the inner fold is similar and contains oil glands called sebaceous glands. If you pull the labia apart, the labia majora, you'll see the labia minora, and that is the inner lips of thin skin surrounding the opening to your vagina. Then there are glands, Skenes and Bartholin's, which produce mucus and other lubricants, and those are found in the labia minora. And so this kind of helps with the natural lubrication of the vagina. So these lumps and bumps potentially on the vagina or vulva can be normal, or they could be a sign of a condition that requires medical attention. And so I want to go over some possible causes for changes to the skin of your vulva and vagina. So you can have what's called a vulvar cyst. And so again, because there are a number of glands in the area, sometimes those glands can get clogged. And so cysts can form, and they can feel hard or soft. They're usually not painful unless they become infected. And they'll generally go away without treatment. But if it does become infective, then it may need to be drained by your healthcare provider, and antibiotics may need to be prescribed. And then there are vaginal cysts. And so these form on the inside of the vagina. They're generally the size of a pea or smaller. Vaginal inclusion cysts are the most common cause of these types, and these come oftentimes after childbirth or injury to the vagina. And they usually aren't painful and rarely cause of concern unless they're causing discomfort during sex. And so occasionally these cysts may need to be drained or removed surgically. Another possibility are varicosities. And so varicosities are swollen veins that occur around the vulva. And that can happen in about 10% of pregnancies and also as we age. And so they are bluish, raised bumps around swollen veins in the labia majora minora. And so they generally aren't painful, but sometimes they can feel heavy. Sometimes they can cause itching or they may bleed. And so treatment generally isn't necessary. They generally occur more frequently during pregnancy, and they usually recede about 6 weeks after childbirth. But they can also recur during subsequent pregnancies. For non-pregnant women, they can be a bit embarrassing, sometimes cause discomfort during sexual activity or when standing for long periods. And so if it becomes a real concern to you, then you could see a vein specialist who would be able to treat that for you. Another cause for bumps in the genital area is ingrown hairs. So shaving, waxing, or plucking your pubic hairs can increase your risk to get ingrown pubic hairs. And so these cause small, round, sometimes painful or itchy bumps to form. And they could be filled with pus. The skin around the bump may also become darker. And so it's recommended to actually not try to extract the ingrown hair on your own because it can lead to infection. In most cases, it will resolve without treatment. And so you would want to seek medical attention if it becomes inflamed, because then that could be a sign of an infection. Another cause of bumps in the genital area are skin tags. Skin tags are small, protruding flaps of extra skin. They don't really cause harm or discomfort unless they rub or get caught on something and become irritated. If your tags are bothersome to you, they can be removed surgically or with a laser. I have seen vaginal tags in certain areas where it does kind of make me think, is that a genital wart or not? And so definitely if the location of these things are concerning to you, because you can also have them in other areas of your body, then definitely have them checked out. Genital herpes is a cause of bumps in the genital area, and I will be talking about that in my next installment, part 2 of Is That Bump an STI, next time I come live to you guys. Another cause of bumps is genital warts, and that will be the main focus of my discussion today. The final thing I do want to mention is cancer. Now, cancer of the vulva is rare. Cancer of the vagina is even more unusual. Symptoms, though, can mirror benign conditions of the vulva and vagina. And so they are diagnosed by taking tissue from suspicious areas to be examined under the microscope by a pathologist. Now, concern for cancer is raised in older women who have persistent or worsening symptoms, including flat or raised sores or bumps on your vulva that do not go away or change over time, skin color that is lighter or darker than the surrounding skin, thickened patches of skin, itching, burning, or pain that just doesn't resolve, sores that don't heal within a few weeks, and unusual bleeding or discharge. And so again, if you are an older individual and you keep getting treated for persistent vaginal infections or things like that, then oftentimes in my patients, I'll go ahead and do a biopsy of the vulva to make sure that we're not missing anything. And so I want to spend the rest of my time today talking about genital warts. And genital warts are a type of sexually transmitted infection caused by the human papillomavirus, HPV for short. HPV can be spread even if the person does not have any genital warts that you can see. There is no treatment for HPV, but genital warts can be treated by your doctor. Now, these warts appear as a small bump or a group of bumps in the genital area. They are flesh-colored. They can be flat or they can look bumpy like cauliflower. Some genital warts are so small you can't even see them. And they are spread most often through direct skin-to-skin contact during vaginal or anal sex. Rarely, genital warts are spread by giving oral sex to someone who has HPV or genital warts. by receiving oral sex from someone who has HPV or genital warts on his or her mouth, lips, or tongue. And during childbirth, HPV can be passed on from the birthing person to the baby. Now, in people with vulvas and vaginas, genital warts can grow inside the vagina, on the vulva, cervix, or the groin, in or around the anus, on the lips, mouth, tongue, or throat. And this is very rare. In people with penises, genital warts can grow on the penis, on the scrotum, thigh, or groin. In or around the anus as well, and on the lips. Having sexual contact with someone with HPV that causes the types that cause genital warts. Sometimes they even can appear within days or weeks, while other people don't show any warts until years later. Some people may get HPV but never get genital warts. So it really varies. If you decide to have warts removed, it is very important not to use over-the-counter medications meant for other kinds of warts. There are special prescription-only treatments for genital warts, and your healthcare provider may prescribe that medication for you. Your provider may also apply a chemical to treat the warts in the office, or prescribe you a cream that you apply at home. Surgery is also an option. These are for more extensive warts where the doctor would use an electric current to burn the warts off, use a laser or light to destroy the warts, freeze off the warts, or cut them off, shave them off. And so remember, though, that the treatment only removes the wart. The treatment does not cure the HPV, the virus that causes the warts. Now, some people choose not to treat the genital warts. And if left untreated, they may go away, they may stay the same, or they can grow in size and number. Genital warts, though, will not turn into cancer. Even if you have genital warts, even if you treat the warts, you can still spread genital warts and HPV to other people. And it's not known how long that you are contagious after the warts appear. Warts can also come back after treatment. And you can still spread the HPV to other people after the warts are removed. And so it's really important then to practice prevention, and I'll give you some tips about that before I close. I do want to mention a special circumstance of pregnancy. If you have had genital warts and they've gone away on their own, or they were treated, you generally will not have any problem during your pregnancy, but definitely let your health provider know if you or your partner has ever had genital warts, because if they recur during pregnancy, they could bleed and grow in size and number due to the hormonal changes in the body during pregnancy. They can potentially block the birth canal. And if that happens, you may need a cesarean section delivery. And also exposing the baby to the HPV types that cause birth during warts during childbirth actually can get the HPV into the baby, which can cause a very rare condition called recurrent respiratory papillomatosis. And so, again, if you have that history or you notice warts while you're pregnant, definitely bring it to your provider's attention. Now, the best way to prevent genital warts or any STI is not to have vaginal, oral, or anal sex. Now, having said that, if you do have sex, then you can lower your risk of getting an STI by getting the HPV vaccine. It is approved by the Food and Drug Administration for people ages 9 through 45 now. And so this protects against the HPV types that cause genital warts, as well as most cervical and anal cancers. Use condoms. Condoms are the best way to prevent sexually transmitted infections if you have sex. Make sure to put the condom on before the penis touches the vagina, mouth, or anus. Now, however, the virus can still infect areas that are not covered by the condom. And so that is something that you always want to be careful about. I often talk to my patients about not being shy about looking at the areas of the genitals and making sure everything looks okay. Don't be shy about it. Because obviously, if you see something that's visible, then you want to avoid having sex, even if you have condoms available. Also, remember that other methods of birth control do not protect you against STIs. So the condom, male and female, are the only ones that do that for you. Get tested. Be sure you and your partner test for sexually transmitted infections. Talk to each other about the results before you have sex. Reduce the number of partners you have. Now, having sex with one partner can lower your risk for STIs. After being tested, you and your partner know that you're disease-free and you're only having sex with each other, then that lowers your risk. Now, having more than one partner does increase your risk of sexually transmitted infections. And so that risk goes up with the number of partners that you have. Do not douche. Douche and remove some of the normal bacteria in the vagina that protects you from infection, and this may increase your risk of getting STIs. I always talk to my patients about alcohol consumption and drug consumption and sexual activity. And not that, I want to admonish people about their lifestyles, but it's important to understand that if you're drunk or high, you cannot consent well and not be clear and understand what's happening during sexual activity. And so this puts you at risk for possible exposure to sexually transmitted infections. Now, these steps work best when used together. No single step can protect you from every single type of sexually transmitted infection. It's still possible to get genital warts or any other STI by being as careful as possible, because again, as long as we're sexually active, that risk is possible. Also, it is possible to get genital warts if you are a woman who has sex with only women. So it's really important that you talk to your partner about her sexual history before having sex, so that you can have a better idea of what your risks are. And so that is all I wanted to share with you all today. I hope that you found this very helpful. Again, there are various reasons that you can have bumps on your vagina or vulvar area. And there are many other causes besides sexually transmitted infections. However, we do want to diagnose and determine what's going on if it is a sexually transmitted infection, so that we can reduce your risks and the risks of your partners. So I will end there, and you guys have a great rest of your day. And I'll see you in a couple of weeks.